I'm going to get us started. So we are going to spend some time talking today both about the NIMAC network as well as all the other networks that cover the rest of the country. My name is Alyssa Terry. I'm a genetic counselor in upstate New York, and I represent the NIMAC regional network. And thank you so much for joining us today to hear about the work that we're doing and the work of all the other regional networks. I promise I'm going to get everyone out of here on time for the 5:45 session on Latin American immigrant experience in genetic counseling, because I know I want to be there, so I'm going to get you there too. So please take a moment while we're on this slide, look at the map, make sure you're familiar with which RGN that you're in so that when your person comes up, you know what's going on in your region, although we do try to make sure that the resources of any of the regions are as available as possible to the other ones. And we will share the slides out to people that registered for the meeting as well. So don't worry about trying to write everything down. So for people that don't know, NIMAC is the New York Mid-Atlantic region. So we cover kind of the Mid-Atlantic states as well as Puerto Rico and the Virgin Islands. And we are one of 7 RGNs which receives federal funding. We are supported by the National Coordinating Center, or NCC, and we also work with the Family Center, who you will hear from right after me. And we have a history of collaborating with NSGC as well as ACMG, the genetic counseling training programs, regional and state genetics groups, family organizations, and lots of other groups. I mentioned before what our territory is. It's listed there. Our mission, which is very similar to the other RGNs, is to work with the stakeholders across our region to make sure that families have access to quality care and appropriate genetics expertise when they need it. So this is our flyer, and my colleague Pat is going to drop that link in the chat for you so you can find the flyer. It just goes over kind of what we do and who we are, what our main resources are at this time. We do a lot of work in telehealth. We also have teams in each of our jurisdictions and do a lot of educational outreach. So you can find more information on the flyer, which you can find online. There are lots of different ways that we encourage people to engage with NIMAC, whether that's through a funded collaboration, using our website or educational events, attending a meeting or training, being on one of our teams or advisory committee, or through student collaboration. So there's lots of different ways that we hope to work with people. I want to highlight a couple of quick things about our website. There is a language translation feature on the top right there. There's a folder of resources for providers, as well as a different one for patients and families. You can find our events on the events tab, and we also keep a place for student surveys. We work with all of the networks to keep a clinic directory as up to date as possible. So you find that throughout our website with the red oval there I'm pointing to. And coming soon on the website, you will also find a section on Spanish resources, as well as dedicated pages for Puerto Rico, the Virgin Islands, New York, DC, and Virginia, with our other states coming soon. And Pat's going to drop the link for the website so you can visit there. A couple educational activities I wanted to highlight quickly. We are collaborating with Heartlands on some Spanish language videos on genetics topics. We have a dedicated website for telegenetics program planning. We have a lot of red flags tools available across different specialties. And we have a video that we developed last year, which shares the stories of 3 families and their journey through the genetic system. And it's really meant for newly referred families to get a more clear sense of what the genetics journey might look like. And all those things are available online, and we will share those in the chat. In terms of things that are coming up soon, we have on the 1st a webinar about telehealth from the Johns Hopkins system, where they share some of their tips and tricks after all of their visits. We have a training session coming up for families in Puerto Rico on October 6th and 8th that we developed in collaboration with Family Voices. And then this April will be our 3rd annual virtual meeting on the 4th and 5th. And below that, I also want to point out that the recordings from the 2021 meeting are now available for CME and CEUs, and you can find that information on our website. So we'll put the links for all 3 of those activities in the chat. Like our other RGNs, you can find us on social media. The bottom of the website, you'll see the links to our Facebook, LinkedIn, and YouTube. We're going to put those in the chat. I definitely encourage people that are in our region, if you know of regional events or even national, awareness days or other things that would be relevant for NIMAC to be sharing, please send them our way. We're happy to share events from other organizations that are relevant to our families. So please feel free to collaborate with us on that. We do a lot of work around family engagement. Certainly in our annual meeting, we have a lot of family speakers and attendees. We work closely with the Family Center, who you'll hear from in a moment, as well as our regional family to family and parent to parent groups. We have a lot of family members on our state teams and leading our state projects, as well as on our advisory committee. So it's a really important part of the work that all the RGNs do. And with regard to what NIMAC has been focusing on with DIE efforts, we're really trying to learn a lot from the work that we're doing in Puerto Rico and the Virgin Islands with the local stakeholders there and understand its application to the continental states that we work in. DIE is really an important focus of all of our state teams when they're considering what the biggest needs are in their respective states. We're doing more work with communities like health fairs and things like that, as well as with supporting minority students. If you have not heard of the Golden program, I encourage you to find out more about them, and we'll put that info in the chat. This is a program that launched last year to support Black students who are interested in genetics careers. And you'll hear more today from Western states about the Minority Genetics Provider Network as well. We do a lot of work around telehealth. So just like everybody else has seen, we've seen a big increase in telehealth over the last few years. We provide both one-on-one technical assistance, and we've been with over 150 providers, as well as training over 80 providers and students in our region. We've funded 10 programs, and all those programs have seen big increases in their planning scores and their telehealth counts. And we've had about 20,000 patients seen over the years in NIMAC supported clinics. More recently, we're looking now to understand how telehealth can work in Puerto Rico and the Virgin Islands. That's sort of kind of the latest news on telehealth for us. I mentioned the training on the last slide. We're continuing to collaborate with Western states on telegenetics training opportunities. It will be fully online this year, and the curriculum was updated post-pandemic to represent the new realities of telehealth. It's a combination of self-paced modules and an online event. So we'll put my email in the chat there, and you can reach out to me if you are interested in hearing more about that training opportunity. I want to mention quickly the NIMAC teams. So we put together a team of diverse stakeholders across each of our jurisdictions to help us understand what's working well and what's not working well in genetic services in each state. In our first year, we focused on DC, New York, and Virginia, and began our work in Puerto Rico and the Virgin Islands. And in that time, Virginia has started to develop a genetics navigator training in collaboration with the Mountain States. DC is focusing on a video project to record families talking about their DC genetics journey. And New York has developed an infographic as well as a social media campaign to address the questions that they felt New York families were most commonly asking about genetic services. So be on the lookout for those projects launching soon. And just sort of an FYI about what's happening in the territories, our work there is really being led in collaboration with Family Voices and the Bogota Global Engagement Firm, in combination with locally led teams to help us understand their needs and make plans. We have training both for families and for providers, as well as a social media campaign. We're focused on increased engagement of the stakeholders in all of our work, and collaborating with other NIMAC institutions to build telehealth to Puerto Rico and the Virgin Islands, as well as collaborating with universities there and Columbia University in New York to explore interprofessional education opportunities. And overall, really focusing on a detailed methodological evaluation of that work over time. And the last thing I want to mention, because we always hope to have students with us or people from training programs, we do work with a lot of students. We have established relationships with Pittsburgh and Columbia. We encourage students to join the state team, and sometimes that can even serve as a thesis project. We do offer the telegenetics training for students, as well as sometimes other thesis opportunities. We work with students around community education, the diversity efforts like the Golden program that I mentioned. We had great attendance from students at our annual meeting, and we also encourage them to work with us on sharing developing resources. So that is it for me. I do encourage you to join us, whether that's through a team or a resource, providing a lecture, telling others about NIMAC, attending one of our events, using our website, or just following us on social media. We're going to drop those links in the chat again so you can find us. And with that, I'm going to pass this off to Megan Lyon with the National Coordinating Center to describe what the RGN system does from a national level. So Megan.
Thank you so much, Alyssa, and thank you so much to Alyssa and NIMAC for the invitation to speak to you all today. So as Alyssa said, I'm Megan Lyon. I'm a Senior Program Manager for the National Coordinating Center for the Regional Genetics Networks, or otherwise known as NCC. So NCC works collaboratively with all 7 regional genetics networks and the Family Center, which you'll hear from everybody today, which is exciting, really to work towards that goal of improving access to genetic services for underserved populations. So I'm going to give a very high-level overview of some of the efforts of NCC. There's going to be a lot of information, so I encourage you please go to our website or reach out to me after if you have any questions. So we have a couple of educational efforts that are done at the national level. The first is the ACMG Act Sheets and Algorithms. If you are familiar with those are an NCC-funded project, and they started as newborn screening resource to help non-genetic providers, but we've really grown those since the inception of the ACT sheets, and now it includes secondary findings, non-invasive prenatal screening, among others. And we're actually really excited also to be announcing that we're doing a large update on the existing newborn screening ACT sheets. So you'll see those start coming out this fall, that there's a number that need to be updated, and so that we're working through those updates now. So we encourage you to go in and explore the ACT sheets. And then we also have a new resource associated with the ACT sheets that offers CME credits. You could get CME or CME other credits for it. It's a short animated video that accompanies an ACT sheet. So the first one is about spinal muscular atrophy. If you don't want to claim credit, you can still access the video on our website, so you can see it details the information that is on the ACT sheet, so it accompanies the SMA newborn screening ACT sheet. We also do data collection and evaluation for the system. So if you were on at the beginning, Alyssa was showing the national level numbers from across our system, across performance measures. So HRSA, who funds all of us, defines a set of performance measures that all 7 regions report on, and NCC and Family Center report on a few of those measures as well. So NCC is charged with collecting and then disseminating that information through national reports. And so you can go to our website to see those charts that Alyssa was showing, and you can also click through it and actually find the resources associated with how we got to those numbers. Another program that Alyssa talked about that is managed and funded by the NCC is the Find a Genetics Clinic Directory. This is a huge collaboration effort with all of the regions and NCC to make sure we have up-to-date genetics clinic information from across the country. So NCC helps maintain that system. NCC is also charged with presenting information about genetics policy from across the country. This is something we've been doing for a number of years, and we're really excited to be launching what we're calling the Genetics Policy Hub later this fall. So we have a couple of existing resources on our website that you could go in and explore today. One of those is an interactive map that is updated daily of a proposed legislation and regulation at the state and federal level. So you can go through and see what pieces of legislation or regulation are happening within your state or the federal government. And you can go through, click on the map, learn more, explore the bills, things like that. And so we also launched a Twitter account this fall that pairs with our interactive map. So you can go and follow that Twitter account. Now it's at Genetics Policy, and it presents the policy information that is available through our mapping function. We also have our state Medicaid genetics policy database, which is updated annually. The 2021 update will be coming in a few weeks, and it looks at written policies from each Medicaid program related to the delivery of genetic services. So we really go and encourage you to explore that. We also have a number of other resources, such as a newsletter, and we're developing a policy areas. All of that will be under the moniker of Genetics Policy Hub, which will be a fully integrated website that's searchable. So say you're interested in a specific type of genetics policy, like informed consent or a certain condition, you want to learn more about policies related to that condition, you'll be able to find that on the website. We also have our healthcare interpreter training program. So most of the regions this year will be offering a training of healthcare interpreters within their region. And so we encourage you, as those are announced, to tell healthcare interpreters you work with. The programs are either for prenatal or pediatric genetics. As a coordinating center, we also are charged with disseminating information and really bringing together resources not only from our system, but from others. And from that, we created Public Health Genetics Week. So this is an annual awareness week that happens every May. That again is a huge collaboration. It's not only NCC, but there's a lot of people on this call right now who are very integral to the success of that week. And so we encourage you, there's actually a whole other website dedicated just to Public Health Genetics Week that you can go in, learn more about what public health genetics is from our system's perspective, but from others as well. NCC also has our resource repository, or we otherwise call it RERE. And RERE has all of the resources from the regions and our national partners. And then finally, we are developing a telegenetics operating procedure through our telegenetics work group, and we hope to have that published later this year. So again, thank you so much to NIMAC for the opportunity to speak, and please feel free to reach out if you've got any questions.
Thank you, Megan. And now I'm going to welcome Molly, who will share some information about the Family Center with me.
Thank you, Alyssa. So I am Molly Martsky. I'm with Expecting Health, and I get the great privilege of working with the National Genetics Education and Family Support Center, as everybody has affectionately called it, the Family Center. And you'll hear a little bit about that. It is a HRSA funded project as well. And so we're that third kind of piece of the three pieces that are funded through the genetic services branch at HRSA. It's the NCC, the RGNs, and then the Family Center. So the Family Center is really charged with ensuring that families, they understand the implications of their genetic diagnosis, that they have access to genetic services, and they're engaged in their own care, as well as that they have opportunities to engage with the system, whether that genetic system is at their local level, the regional level, or potentially a national level through some of the RGNs activities and stuff like that. We do that in a number of different ways. So again, we try to provide information. We've created a website that we just launched earlier this summer, and so we continue to build that out, but really looking at it from that family's perspective and seeing what they need to know, or what they're looking to know, I should say. We look to connect them to other family leaders so they get some of that peer-to-peer support, as well as those opportunities within the healthcare system. Like I said, whether that's at that national level, serving on work groups, or if they're potentially looking at becoming engaged with us at the Family Center, we have a few opportunities for them. Diversity, equity, and inclusion is a big part of what we do here. And we are doing it right now currently through two really, I would say, deliberate sort of ways. And so one of them is we have a community of practice on diversity, equity, and inclusion. And that is really an opportunity for family leaders to read an article and then come together and talk about how that might affect the work that they're doing, or that they have the opportunity to do within the system. There's lots of opportunities for that professional side of things to connect to peers, but sometimes that family leader, as they're starting to become in the system and grow their own networks, they don't always have those opportunities for leadership development and leadership training. So that community of practice is really, we have found as a great way of doing that. And then we also have our work group on inclusion. And our work group on inclusion is, while the community of practice, I would say, is a little bit more loose, an opportunity just to come and learn, our work group is really actually looking to create materials and stuff like that. They have been meeting a few months, and they're focusing on access to genetic services. And the way that they're interpreting that is they're planning on developing a questionnaire. So it might be based on questions to ask your genetic counselor, let's say. So it would be a questionnaire that families could bring in with them, because a lot of times families, when they go and begin some of these journeys, they don't even know some of the questions that they should be asking, or maybe the information was given to them, but this gives them an opportunity to kind of ensure that it was, and that they were able to digest it at that point. So they have just started work on that. And the other thing, again, I kind of talked a little bit about that education piece. And so we are in the process of developing actual curriculum around leadership trainings for family leaders, but we also provide other opportunities. We host webinars. And so that webinar, while they're not always geared right for the family, a lot of times it's for that whole system level. So it's family leaders as well as professionals. And one I want to just bring up, we're going to have in a couple of weeks on October 14th, I believe. We are doing a webinar on understanding the importance of language in genetics. So we're going to have a couple of family leaders come and talk about that, some of the word choices and type of things that have either been said to them or things that they've learned, and the way they use language and the way that it's changed over time, from their first appointments through, I guess, right now. So we call that from clinical to casual, and I'll throw that webinar registration material up in the chat. Like everybody, there's all of our stuff. You can connect with us. We'd love to have you join us on social media and keep up to date with what we're doing. So thanks, Alyssa. I was trying to get in my
You're
5
perfect.
minutes. So
Great.
thank you.
Thank you, Molly. Now I'm going to welcome Sylvia to talk about the work of the Western States RGN.
Aloha, everybody. So Western States has many activities that relate to genetic counselors, because we are genetic counselors that run the Western States. So of course, for many years, we've had the telegenetics training for genetics providers, and we've been at NSGC, and we have been advertising the training. It's of no cost to the genetic counselor, especially now that we've gotten into all virtual. So now we have the 10 self-paced modules and the 1 4-hour live virtual session, and you get CEUs and a certificate of completion. Even though most genetic counselors now will have some experience with telehealth because of the pandemic, we have heard from counselors that have taken it, our training after the pandemic started, in that it is a really good way of learning best practices and how to be a better telehealth provider. So that's available. We have a lot of telegenetics and telehealth resources. We were tasked to develop a lot more resources for families that you serve, because providers were getting frustrated that they had nothing to give to families to help them, because in the past, we used to do telehealth. The families would go to a central site or a clinic or a doctor's office and have someone help them. Of course, during the pandemic, they were trying to struggle to figure it out in their home, how to get a telehealth visit. And there weren't many resources for that, mainly because in the past, healthcare insurance providers didn't pay for telehealth in the home until the pandemic happened. And so we quickly developed a lot of resources to help families, including a video on what to expect from a telegenetics visit. There's also a version what to expect from a telehealth visit if you're not going for a genetics visit, going for an endocrine visit or something like that. It's also been translated through our grant from the Association of Maternal Child Health Programs into Korean, Mandarin, Cantonese, it's in Spanish. We have Ilocano, Tagalog. Our most prized one is our translation into Samoan, because that was a really interesting trans conversion where we worked with people from American Samoa and to work on what the clothes the people should be wearing, what their houses look like, things like that. So that one was really cool. We also, of course, have, hopefully you've heard, the Minority Genetic Professionals Network. We've been at NSGC for the past several years now, so I hope you came to our booth when we were there in person. We support minority students to enter genetics professions, not just genetic counseling professions. And we also support current students that are in training programs and minority genetics providers. I think the number one thing that we get feedback about for NGPN is that it is a fantastic source of networking. So even if you don't need any resources, you're feeling okay, whatever, it's a great place just to meet people who have similar experiences in genetics professions as you might, being the minority in genetics professions. All of the information can be found on our website, westernstatesgenetics.org. And much more information. One of our big projects for this coming year that our family advocate leaders are now ready to take up is that we have helped our family advocate leaders learn how to guide their families that they serve to genetic services. But we also realize that our genetic providers, especially genetic counselors, do not know all the services that our family advocate organizations like Family to Family Health Information Centers and Family Voices and Parent to Parent actually can help provide to the patients that genetic counselors serve, because they do a lot of things that based on the state, they do a lot of different things, but a lot of things like helping families get insurance, finding respite care, finding social services, helping them with figuring out education plans, getting accommodations, and just general support, because the family advocate organizations are usually run by people who are peers. So they also have children with special health needs. And I have to tell you that our family advocate leaders are the most wonderful people ever. So I'm very giving and wanting to help people. And I think that that would help genetic counselors save time in trying to help families with some of the things that we're not experts in. And so we can concentrate on giving them all our time and effort on all the things that we're really good at, and then let the other experts help them with all the other ancillary and support services they need. So thank you.
Great, thanks, Sylvia. Now I'm going to welcome Amy, who's going to speak about the Southeast RGN or CERN.
Thank you. I am excited to tell you guys a little bit about CERN. We cover 8 states in the south of the US: Alabama, Florida, Georgia, Mississippi, Louisiana, North and South Carolina, and Tennessee. And just this past August, we launched a new website. I put the website on the slide here. I'm going to touch on a few things that are on the site, but honestly, it's got a lot of resources on there. So I will put it also in the chat afterwards. But just to talk also about a few of our current activities in our regional work groups, in addition to the website resources. So on the website, we have a Find Genetics Clinic directory that will help our patients locate any genetic centers in the Southeast. We do have everything split up into good for providers and good for consumers, so that people can easily find things that are applicable to them. We've got some frequently asked questions on general genetics, which is a resource for families and patients. It covers the most commonly asked questions pertaining to the basics of genetics, genetic testing, genetic evaluations, and more. We've also been working with Heartland Region to create some newborn screening and genetics videos in Spanish. And so those will be available, and they are on newborn screening, genetics, and chromosomes. So that'll be exciting when they're done. And then we've got Emergency Preparedness Toolkit is one of the things that's posted out there, and that was created by our Consumer Alliance work group. That I'll describe that work group in a moment, but it's a bunch of families and parents that got together, and because emergency planning is so important for our families, it lists, it's listed on the website. There are resources that can help them develop their own emergency plan. And we have one major one that's kind of for all disabilities and medical conditions that might be. And then there are some specific to different metabolic disorders in particular, and they're available in English, Spanish, and also in dyslexic friendly language, which is a different kind of typing and font and everything. So, and that's just the tip of the iceberg, but I'll move on. We've got a CERN and Surge annual meeting that happens every summer. So it's now going to be on July 14th and 16th in 2022 in Asheville, North Carolina, all things being equal. And there will be a call for abstracts that it will be announced in the spring, both through our website and also through our listserv, which I'll also talk about in a moment. There will be some funding for some travel awards for students. The abstracts, our meeting this past year was virtual, and on the Surge website, which is the Southeast Regional Genetic Group, those abstracts are still available. So if anyone wants to take a look at those, I will put that link up in the chat as well. And then there's, we do lunch and learns for educational, just to kind of keep everyone up on current topics in genetics. And we hold those 2 to 3 times a year. We just had one this past Friday that was on the expanded newborn screening in North Carolina. And we record all of these lunch and learns, and they're available on the website. So if you want to look at those, there's some that are listed more kind of patient friendly and some that are more provider friendly. So we've got those split up so that they're easily identifiable. We also do a genetic nutrition traineeship where we use ECHO, which is an all teach, all learn case-based methodology. It's a 12-week traineeship that is focused on increasing knowledge of providers treating patients with inherited metabolic disorders. Most of the people who are in the cohorts are dietitians, but there are genetic counselors. And I would say that if you serve these types of patients, it is incredibly useful to have that information. It's a great traineeship. We are currently in our 3rd cohort, and the next cohort is scheduled to start sometime in February or March of next year. Then just to quickly describe our work groups, we have a telemedicine work group that meets every other month. And we also support the trainings that you've heard some of the other, we support the people going to the trainings that some of the other RGNs have mentioned. If anyone is interested in joining our work group, you can contact Teresa Pringle. Her information is down at the bottom there. Our Consumer Alliance work group is an active group of parents with children with genetic disorders. And we are always looking for parents in the region to join, share their expertise. Like I said, they made that emergency toolkit, and they do a lot of other good work for the region. I will leave also in the chat a link that you can click just to join the listserv if you would like, and that will also help to join the Consumer Alliance, or you can reach out to Teresa. And then the last work group I'll touch on is our nutrition management group, which created some guidelines along with the Genetic Metabolic Dietitians International group. And they developed these guidelines based on evidence and consensus-based input for the management of inherited metabolic disorders. And so those fact sheets and FAQs for the various inherited metabolic disorders are on the website as well. If anyone does want to join our email list, like I said, I'll put that link into the chat. And if you have any other questions, Teresa Pringle is our program manager, and she's wonderful and has lots and lots of answers. And I will stop there.
Thanks, Amy.
Sure.
And now I'm going to welcome Anne, who is going to talk about the Heartlands RGN projects.
Great, thank you. So for Heartland, we, through the work with a few of our work groups, and now that you've heard from a few RGNs, we all sort of depend on our work groups. So this is, we focus on 2 racial and ethnic minority communities in particular, and that was the Spanish-speaking and also Marshallese. So as actually CERN and a couple others have mentioned, we at NIMAC, we are all working together across RGNs to develop these Spanish language videos. And so we now have completed 4 of them. And these are the topics, and they are now living on our YouTube channel. And also we're developing 2 more. And so this is all done with families and focus groups. So we actually, throughout the whole process, developing the script, we take it back to the families, and then we develop the next step, and then we go back to the families again. So it's very involved. The families are actually very involved in the development process of the videos. So next slide, please. And we also have, similar to our Spanish-speaking communities and the Marshallese with whom we work, the communities are mostly in Iowa and Arkansas, and also in Oklahoma. We always get feedback from families on the type of media they like to see, and that they will find most helpful and receptive by their communities. So we've developed a newborn screening video all in Marshallese, and also have produced pamphlets to discuss newborn screening, and Eddie, as well as producing a tip sheet for providers. And we've actually disseminated them to genetic counseling students as well, to talk about the Marshallese culture and to provide suggestions on how to interact with Marshallese patients during the appointment, especially in terms of taking family history and a lot of these pretty vital steps in providing the care that culturally that they are able to see some of those challenges and overcome some of those barriers. And so these have been products and also efforts that we have been working on with our advocates and our community engagement work groups. And also, I just wanted to mention that as far as other resources, just last week, our clinical services work group actually, based again on feedback from our communities, have done a webinar on prior authorization and letters of medical necessity. So how to maximize impact, how to overcome some of these barriers, especially when it involves reimbursement. So we're actually creating a large library of these resources, and we'll probably conduct a few more webinars. And so the next slide is our contact information. So any follow-up or questions that you may have, we're happy to answer them. Thank you.
Thanks, Anne. And now we're going to hear about what's happening in the Midwest RGN from Matt.
Hi, everybody, and thank you, Alyssa, for inviting us to do this. This has been fun to hear everybody's stuff. So my name is Matt Edick. I'm from the Midwest Genetics Network. We serve 7 states in the Midwest. I've put them on the slide for you. It's Minnesota, Wisconsin, Illinois, Indiana, Michigan, and Ohio, and Kentucky. And our network has always focused really heavily on ensuring we have really diverse sets of stakeholders sitting at the table for all of the things that we do. And it's been fun to listen to all of my colleagues tell about all the work they're doing. Makes it really easy for me. We do a lot of the same stuff. We just do it in different spaces and sometimes with different approaches. So I wanted to just take a few minutes and highlight some of the bigger picture ongoing initiatives that are coming out of Midwest Genetics Network. We spend a lot of time focusing on provider education in the Midwest. We have a fairly large program in quality improvement and continuing education. And this is a program where we develop materials and resources and projects that educate primary care providers about topics in genetics that are relevant to the care of their patients, but maybe that they don't either know a lot about or are not exposed to on a regular basis. And we develop these projects in collaboration with primary care providers, with genetics providers, including many genetic counselors that help us out with this work, as well as family members and researchers and other types of clinicians and public health professionals. So we really try to bring a broad perspective to the table, not only to make sure we have good quality products, but also to ensure we have relevance across many stakeholder groups and that we produce things that are useful. We also have a program for the last 4 years now, to make grants to organizations across our region. We call these innovation awards. And they're small awards that organizations can apply to support things like building infrastructure for telehealth. When we first started this program, that was a really big deal to many organizations that wanted to use telehealth to provide genetic services, but didn't have buy-in maybe from their upper administration or for whatever part of their organization that they needed, or maybe they need a little money for business planning or equipment, whatever that was. But as time went forward, we noticed we were getting a lot of applications for really innovative implementation projects, reaching into communities that definitely underserved in genetic services. And so we really now focus that program mostly on innovative implementation projects. We also have a few pretty large efforts related to long-term follow-up of newborn screening. One of them is working with individuals from the Plain communities, so Amish and Mennonite and Hutterite communities. And the goal of that work, and this has been a long and slow process for us, but it is to understand how Plain communities interact with and use the newborn screening system, to understand how that system can better serve and meet their needs around newborn screening. And then in addition, in that vein of long-term follow-up, we have a newer project that got started probably 2 years ago, working to connect individuals with PKU that are lost to follow-up back to clinical services. And this is a project we've been doing in collaboration with National PKU Association. And then finally, some efforts in telehealth. There are many really strong efforts across the country in telehealth, and Midwest was kind of a late adopter of work in telehealth. And so really we focus our work in telehealth around supporting our stakeholders. We have an Echo platform that we established to do telementoring, hosting trainings. We have a community of learning within the region, but largely we rely on the colleagues that you've heard speak already, and I think you'll hear a couple more speak about trainings that have been developed and resources that have been developed, and we use those to help our stakeholders and clinicians be versed and use telehealth to serve our patients. Can you go ahead and go to the next slide for me? And so if you have any questions, you certainly can reach out to us. The best way to do that is through social media, and I've put our social media handle there on the bottom. Twitter is probably the one we use the most, but we're on Facebook as well. And you can find us at, excuse me, at Region 4 Genetics. Also, you can visit our website, which I dropped that link in the chat. We have a newsletter. You can sign up for our newsletter and receive that. Lots of great information in there about upcoming events and stories from our family members. You can access our resources that have been developed over the years, register for events, and quite a bit more. And just one event that I want to mention, and I'll drop it in the chat as well. During our annual meeting this year at the end of the month, on September 30th, we're hosting a live Twitter chat, and the topic of that Twitter chat, there we go, is diversity, equity, and inclusion in genetic services and how that can impact access to care. And so we have 6 or 7 invited guests who are going to be participating, but of course this is a Twitter event, so anybody can come participate. Muin Corey from CDC will be on there. Megan Lyon, who you heard from earlier, will be on there. Representative from Minority Genetics Professionals Network will be on there with us. We're hoping to have somebody from NHGRI join us, and actually somebody from NSGC as well, but we haven't had confirmation. But anyways, there'd be some hopefully really thought-provoking and interesting questions, and would love it if you are a tweeter to come tweet with us during that half hour at the end of the month. And with that, I'll stop because I'm pretty certain I went past my 5 minutes. Sorry.
That's okay. Thanks, Matt. We're now going to be joined by Karen, who's going to tell us what's going on with the Northeast RGN.
Thank you so much, Alyssa. It is great to hear everybody's run through. And I want to start out by saying it is just a joy to see how much the RGNs work together and share. It seems more and more we're really encouraged, and we take advantage of programming by the other regions. So it's been just had a huge impact, I think, on all of our work. Certainly in New England it has. The New England Regional Genetics Network, or NERGN, as you can guess, pertains to the 6 New England states. We are housed at the University of New Hampshire, which is where my little desk is, at the Institute on Disability. And we have partners in all of the New England states. Our projects, you've been hearing about others that are kind of touching the same things as many have said. We do work quite a bit in telegenetics, and we would love genetic counselors to come to our telegenetics training that's put on by the Western states. And we also support Bay State Health Center a bit more on a telegenetics project. We're actually paying for genetic counselors' time because it's not reimbursable in Massachusetts to do telehealth for their particular situation. So that's an area that we're able to support a bit more and work with them. We also work with the Weitzman Institute, which is a great organization down in Connecticut. And we offer an echo model as well. And we have kind of short and more informal genetic webinars. All of these are archived on their website and on our website. The Southeast mentioned the group CERN. We have NERG. So there's NERG and NERGN, and CERN and CERG. We all work together, and NERGN works with NERG to help produce their annual meetings. It's great because they are traditionally known for offering CMEs and CEUs. So it's great for us to support them and for us to work together so that we're sure that providers in the region have access to the training needs that they have. We also work with the family organizations and mostly Family Voices, but they go by other names as well. And some of that work is leading to more concentrated efforts with a couple of different populations, one of which is the Amish population in northern Maine, also the American Indian communities in northern Maine, but we're having a bit more struggle there, but we're working on that still. And we're also fairly connected and working on the Bhutanese community in Vermont. So Sylvia mentioned use your family partners. I just really want to second that. If you have families that need to be connected, sending them there can be a real lifesaver. So I would encourage that. Finally, what we do that maybe is a little bit different from some of the other regions is on our website, we have what we call GEMS, Genetic Education Materials for School Success. And it is designed by a geneticist, genetic counselor, family specialist, and family organizations, kind of having a lot of specialized information strategies and tips for kids with 37 different genetic conditions. I'm trying to help them have a successful school experience. So it's been really well received. It's updated information. I encourage you to check it out and see if this might be something you could share with your families. We also have a newsletter, so please do sign up. And that's all I've got. Thanks,
Perfect.
Alyssa.
Thanks so much, Karen. And for our grand finale, Christy is going to walk us through the great things they have going on in the Mountain States.
Thanks. I'll make this quick because I see we're coming up on that transition time to the next talk. So we are the Mountain States. I'm Christy Weiss. These are our 8 states, as you heard from everyone else, their states. And we have very similar mission statements. We really are trying to ensure that individuals with genetic disorders and their families have access to quality care and appropriate genetic expertise and information. Next slide. This slide just highlights 5 things that are going on within Mountain States that I thought I would highlight very quickly. If you have more questions or want to learn more about any of these, please feel free to reach out to me. I have my contact information at the end. We have state teams. Each one of our states has a multidisciplinary team that comes together and meets around topics of genetics in that state, about barriers to care, access to care each month. We have launched this year a Time for Genetics program. That is our primary care genetics education initiative, and we are currently recruiting for our 2nd round of clinics. That application is open right now and due November 15th. So if you know any pediatricians or primary care offices in our region that would like to participate, we would love to talk with them. We also have primary care algorithms, and I just talked to 2 genetic counselors last week who were just thrilled to hear about these because they were having some challenges with referrals to their genetics clinic. And so they said these would be really helpful in communicating with the primary care providers. These are for primary care providers, and they are on the topics of developmental delay and Ehlers-Danlos. We also just launched our Genetic Navigator program. We have 8 brand new trained genetic navigators. I say brand new, but they have been navigating genetics for their own families for years, and now they're ready to help other families in our states navigate the genetic service system. And last but not least, I want to tell you about the Genetics Summit. It is coming up on November 9th and 10th. It is virtual. It is no charge. And next slide. It's all the information's here, but it's on the topic connecting the dots. We have 12 speaker sessions that will explore genetics from the perspective of D for disease, O for outreach, T for total value, and S for social perspectives. And we are pursuing right now continuing education credits for that. So check back on that, but the registration is free. You can scan that QR code or go to our website, and I'll pop that into the chat as well. Next slide. So this is my contact information, my phone number and email, and this QR code, if you scan that, that will add you, it will take you to a form where you can fill it out. I promise it takes less than 30 seconds to fill out, and that will connect you with us. If you'd like one of us to reach out to you, there's an option for that. If you'd like to receive our newsletter and email mailings, you can check that as well. But please, if there's anything that I mentioned today that you'd like more information about, we really encourage you to reach out and also join us for our Genetics Summit and share it with your colleagues. Thank you.
Thanks, Christy. Thank you all so much for your time with us today. It's great to see familiar faces and meet new people.